Running out of space. In Oregon, the number of open hospital beds is declining. Health officials say rising COVID cases are one factor, but this summer there are many others. Staffing, for instance.
We know that many levels of staff have made decisions as a result of the COVID pandemic to cut back hours, to change professions, sometimes leave healthcare entirely.
Dr. Renee Edwards is Chief Medical Officer at OHSU.
Our hospital is completely full.
Like so many hospitals and healthcare providers, OHSU is actively recruiting nurses and other positions. At the same time, they're competing against the growing national demand for traveling nurses and contracted labor. It's a problem that's not just impacting hospitals, but long-term care facilities too. And therein lies another challenge. Some patients are using hospital beds they no longer need while waiting for a transfer to long-term care facilities.
When we can't move our patients from the hospital environments of care into those post-acute environments where patients need ongoing care, then it does create a backlog in the system.
Here's a look at the latest numbers from the Oregon Health Authority. First, non-intensive care unit beds. As of Monday, the state showed there were 58 available in the Portland metro area. That's just 3%. For ICU beds, 20 were available, or 6%. And dwindling hospital capacity is not just Oregon's problem. Multiple Washington hospitals say they too are over capacity and understaffed. That includes Harborview Medical Center in Seattle.
We have not been under this level of stress at any point during the pandemic. This is unprecedented at this point.
Unfortunately, we have returned to the same level, in some cases worse level, of both challenge and strain in our hospitals as we experienced during the periods of those specific surges related to those variants.
This comes as doctors contend with the BA5 and BA4 variants, which combined account for most new cases and are believed to resist both antibodies and vaccine protections.
When both states are at capacity, it creates an extreme situation for the Pacific Northwest.
Dr. Edwards points out emergency rooms are also extremely busy, especially during the summer. It's why hospitals region-wide are asking people to avoid using them except for true emergencies. Instead, they encourage visiting urgent care or your primary care physician whenever possible. And on that note, hospital officials say it's critical to stay on top of your preventive health care. Get regular checkups and don't ignore health concerns. They say many patients who delayed seeing a doctor during COVID now need more intense care as part of their hospitalization.